Hi, I'm here. Let's talk about the bladder. Welcome back to Health and Fitness University, where real talk meets medical accuracy. Today we're focusing on a body part that's often overlooked, your bladder. Your bladder plays a vital role in eliminating waste, balancing fluids, and keeping your urinary tract healthy. But many of us ignore it until there's a problem. So, let's change that. In this video, I'll share simple daily habits, nutrition tips, and hygiene practices to help you prevent infections, improve bladder control, and keep this organ functioning at its best. Let's take care of your bladder the smart, natural way. First up, let's dive into why your bladder deserves some TLC. Your bladder holds and releases urine, but it's also prone to irritation, infection, and dysfunction, especially as we age or experience hormone changes. Ever felt that sudden urge to run to the restroom? That's your bladder doing its thing. Or perhaps you've experienced discomfort or pain in the lower abdomen. Those are signals from your bladder too. Ignoring these signs or not understanding what they mean can lead to bigger problems down the road. Common bladder issues include frequent urination, urgency, burning, and urinary tract infections, UTIs. These might seem like minor inconveniences, but they can really impact your life if not properly addressed. Frequent urination can disrupt your sleep or work, while urgency or leakage can affect your confidence and mobility. And those painful UTIs can make you feel awful and sometimes even lead to more serious kidney problems. Now, before we dive into our top tips, let's talk about your bladder's BFFs, your kidneys, and the urinary tract. Your kidneys are the superstars that filter waste from your blood, creating urine. The urine then travels through the ureters. These are little tubes to your bladder, which stores it until it's time to go. Finally, the pee exits through the urethra. All these parts work together to keep things flowing smoothly. So, how can you show your bladder some love? Start with the basics. Drink plenty of fluids, especially water. Staying hydrated keeps things flowing smoothly and prevents infections by flushing out bacteria. Aim for 6 to 8 glasses of water a day. But remember, if you have a health condition that affects your fluid balance or urination, always follow your doctor's advice. Let's talk about caffeine and alcohol. We all love a good cup of coffee or a glass of wine, but they can wreak havoc on your bladder. Caffeine and alcohol are diuretics, meaning they make you pee more. This can lead to dehydration, making your bladder more prone to irritation. If you do drink caffeinated beverages or alcohol, be mindful of how much you consume and remember to drink extra water to stay hydrated. Watch what you eat. Certain foods can trigger bladder issues. Citrus fruits, tomatoes, and spicy foods can irritate your bladder lining, leading to discomfort or even leakage. If you notice a pattern, try cutting these foods out of your diet for a week and see if it makes a difference. Keeping a food diary can help you spot these triggers. Also, be cautious with artificial sweeteners. They might not be a problem for everyone, but some people find they worsen bladder symptoms. It's a good idea to read labels and choose products without these sweeteners if you suspect they're affecting your bladder health. Urinary tract infections, UTIs, are no fun. They cause pain, discomfort, and a whole lot of inconvenience. Thankfully, you can lower your risk of UTIs by following some simple steps. First, always wipe from front to back, especially after using the restroom. This helps prevent bacteria from the anus from entering your urethra and causing an infection. Second, urinate after intercourse. This flushes out any bacteria introduced during sex, reducing your risk of getting a UTI. Third, be careful with feminine hygiene products. Avoid douching, as it can disrupt the natural balance of bacteria in your vagina and increase your risk of infection. Instead, use unscented soap and water for cleaning. And if you use tampons, change them regularly to prevent bacterial growth. Lastly, if you're prone to UTIs, consider taking a low-dose daily antibiotic as recommended by your doctor. Maintaining good bladder health isn't just about preventing issues. It's also about improving your overall quality of life. Here are a few ways to keep your bladder functioning at its best. When you feel the urge to go, don't hold it in. Empty your bladder when you get the signal. Holding it too long can stretch or irritate it. Drink in moderation. While staying hydrated is important, drinking too much too quickly can overwhelm your bladder and increase your need to urinate frequently. Find your bladder capacity. This is the amount of fluid your bladder can hold before you need to urinate. Knowing your capacity can help you manage your fluid intake and prevent overfilling. Eat a balanced diet. Include foods rich in vitamins C and D, such as fruits, vegetables, and fortified foods. These nutrients support immune health and overall bladder function. Manage your weight. If you're overweight, losing even a small amount of weight can reduce pressure on your bladder and improve your symptoms. Quit smoking. If you smoke, quit. It increases your risk of bladder cancer and other urinary tract problems. Prevent leaks and maintain bladder control. Accidental leaks can be embarrassing and inconvenient, but they're also a sign that your bladder might not be functioning at its best. To prevent leaks, follow these steps. Kegel exercises strengthen the pelvic floor muscles, which help control urination. To do Kegel exercises, first find the right position. Sit or lie down in a comfortable position. Next, find the right muscles. These are the muscles that you use to stop the flow of urine. Finally, do the exercises. Contract these muscles, hold for a few seconds, and then relax. Do these exercises regularly, gradually increasing the number of repetitions. Another tip is to practice bladder training. This involves setting aside specific times to urinate rather than just going when you feel like it. It might sound odd, but it helps your bladder adjust and can reduce the frequency of leaks. Lastly, stay active. Regular physical activity can strengthen your pelvic floor muscles and improve bladder control. Aim for at least 30 minutes of moderate exercise most days of the week. If you're not sure where to start, talk to your healthcare provider. They can help you create a safe and effective exercise plan tailored to your needs. Preventing infections starts with good hygiene. Follow these simple steps to keep your bladder and urinary tract healthy. After using the restroom, always wipe yourself thoroughly with toilet paper or a soft cloth. This removes bacteria and reduces the risk of infection. If you're female, remember to wipe front to back to prevent bacteria from the rectum from reaching the urethra. Once you're done, wash your hands thoroughly with soap and water. This helps remove any remaining germs and keeps your hands clean. Additionally, if you're engaging in sexual activity, it's important to urinate afterward. This helps flush out any bacteria that may have entered the area during intercourse, reducing the risk of infection. By following these hygiene practices, you can help keep your bladder and urinary tract healthy. Some conditions can affect bladder health. Diabetes, for example, can cause damage to nerves and blood vessels, including those in the urinary tract. This can lead to frequent urination, leakage, and an increased risk of infection. Managing your blood sugar levels is crucial for maintaining bladder health. Similarly, an overactive bladder can make you pee more urgently or frequently. This can be due to various factors like age, hormones, or neurological conditions. The best approach is to consult with your doctor, who can guide you on managing your specific situation. They may suggest behavioral therapies, medications, or other treatments depending on your needs. As we age, our bladder health might change too. As men age, they might experience an enlarged prostate, which can block the flow of urine and cause issues like frequent urination or incomplete emptying. Regular checkups and prostate screenings can help detect and manage this condition. For women, menopause can bring challenges. Hormonal changes can lead to a weaker pelvic floor, potentially causing leakage or prolapse. But there are ways to manage these issues, from hormone therapy to pelvic floor exercises. Remember, knowledge is power when it comes to your health. Stay informed, ask questions, and take an active role in your well-being. You deserve it. Now, if you found this video helpful, give it a like and comment your favorite bladder-friendly tip below. Don't forget to subscribe to Health and Fitness University for weekly wellness strategies that help you live better head to toe. If you want more resources on bladder health, check out the links in the description below. At Health and Fitness University, our mission is to empower everyone to make informed health decisions. We believe that real talk, plain language, and medical accuracy can help you navigate the sea of health information out there. Thank you for learning with us. Until next time, stay curious, stay healthy.